Hi, okay, let's get back into part two of week one. Now I wanted to get into immunizations. Again, we're talking about prevention, and immunizations are one of the biggest primary care preventions that you can put into place in your practice. So, in terms of immunizations, we just want to review the concepts of immunity. Active immunity triggers the immune system to produce antibodies to that disease. So, natural is acquired through infection with the organism. Vaccine induced through immunizations provide primary prevention, and it provides a long term protection from disease. Herd or community immunity is a significant portion of community has immunity. That susceptible portion of the group is becoming infected is minimized. So basically, some people will look at not getting immunized by saying, you know what, everybody else got immunized, so I should be okay. But obviously that's not the case. But that's what herd immunity is. Like the majority of a portion of a community is immunized for a particular disease. For instance, COVID, the majority of, hopefully your community has been immunized against COVID. Passive immunity occurs when person receives the antibodies via an immunoglobulin, IG, after an exposure to an infectious agent. It's temporary and the patient needs to present post-exposure, okay? It also could be acquisition of disease protection from mother to child via the placenta, okay? So immunization administration is like I said, one of the best examples of primary healthcare promotion. It provides the patient's body with the ability to build up antibodies to potential life-threatening illness before exposure to the offending agent. Remember, the guidelines for immunizations continue to evolve and change over time, as we have seen recently. Immunizations begin at birth and are continued throughout life. During early childhood, infants and children are immunized with a wide variety of vaccines, okay? Here are the basics: the Hep B and Hep A, DTaP, which would be your diphtheria, tetanus, and acellular pertussis. They get the IPV, which is the inactivated polio vaccine, and they also get the HIB, which is the Haemophilus influenzae type B vaccine. You get your MMR, your varicella, your pneumococcal, and your rotavirus. By the time children are 5 years old, they should have received approximately 25 vaccines. That's just by the time they're 5. Then they should continue to receive one Tdap every 10 years. The recommendations for adults include the annual flu immunizations, as well as the pneumococcal, meningococcal, Hep A, and Hep B immunizations for those with certain risk factors related to their health, job, or lifestyle. So for us as healthcare practitioners, we're obviously very concerned with the Hep A and Hep B immunizations. Tips for the FNP. So the NP is responsible to recommend and prescribe appropriate vaccines. You want to know what your vaccine schedules are. All you need to do is go to the CDC website and they will give you the schedules per age and variations. They have the adults, pediatric, catch-up schedules for those adults who probably maybe not born in this country, immigrants. They also have variations in the schedules for the CDC guidelines based on pregnancy and immune compromised patients. Again, the CDC is your ultimate resource for vaccination schedules. Every year they come out with an updated schedule, and there's lots of resources and patient education related to vaccine-related events. You also want to use the Department of Health for any local outbreaks. So when I was working as a school nurse in a middle school and high school, I was in close contact with the Department of Public Health. Anytime we had a student come in with a outbreak of the chickenpox, 2 students in a school is considered an outbreak, and we would literally have to shut the school down if that did happen. So it's a big deal. Okay, immunization tips for the FNP. So you want to use a catch-up schedule for those missing childhood vaccines. You want to have a detailed content on diseases and vaccines that are newly out. So those morbidity and mortality weekly reports come out from the CDC periodically. You want to have a vaccine information sheet for patient education. Remember, you are not giving out vaccines without this particular information sheet. It should be provided to every patient prior to you even giving the vaccine, to make sure that they have informed consent about what the possible side effects of vaccines are, and what they, the possible side effects and contraindications to the immunization. You should have a written copy of consent for each immunization on file from either the patient or the patient's caregiver. In 1986, the National Childhood Vaccine Inquiry Act required that all healthcare providers report any severe adverse reactions to the Vaccine Adverse Event Reporting System. It's called VAERS. Very important. If you give a vaccine and they have a reaction, you need to report it to the disease control, the Department of Health. Okay. The length of time from administration to the appearance of an adverse reaction can range between 7 to 30 days and is dependent on whether the vaccine actually contains a live virus. So when in doubt, you just want to go ahead and report the event. There's information regarding potential reactions for each vaccine, which is available in something called the Red Book. And it's developed by the American Academy of Pediatrics on the CDC website under the Morbidity and Mortality Weekly Reports. It's just the cdc.gov. That's the website you want to go to for all your immunization information. Keep in mind, they are controversial at times, but immunizations are still one of the best methods we have for preventing illness and disease that can develop from specific diseases such as polio, diphtheria, and H influenza. Always want to make sure, no matter if you're prescribing medication, you're requesting immunizations, you always want to inquire about pregnancy status and last menstrual period. Keep in mind, sometimes women don't know that they could even be pregnant. It didn't even occur to them, but you need to just make sure and double check. Find out when their last menstrual period was, the first day of their last period. And of course, in terms of the immunizations, do not forget, anytime you give an immunization, you need to document the vaccine, the location, the manufacturer, and the lot number. Very important. It's all located right on your vaccine. A lot of the times, really being responsible about immunizations, you want to follow the recommendation that after you give the immunization, you have the patient wait in the waiting area for about 20 minutes to make sure that they don't have any serious reactions. How do I know what vaccines to prescribe? So like I said to you before, you want to access the recognized standards, which is on the CDC website. They do offer CDC immunization schedules. Some EHRs may prompt the provider, and you also want to follow up with the Department of Health for recommendations in terms of any local outbreaks, which us as nurse practitioners, you will get emails from your governmental Department of Health for your particular state that you live in. Wherever you're licensed, you will get updated Department of Health recommendations periodically with any new information. I'm licensed in a couple of different states, and it's interesting to read the Department of Health for each state's recommendations and see the variations in how different governments handle things differently. You want to make sure you use schedules by age and variation and follow those recommendations. You want to consider any previous reactions prior to giving a vaccine. You always want to say, have you ever had a vaccine before, or have you ever had a reaction to any vaccine that you have received? You want to check allergies or variants, such as pregnancy, obviously, if a patient is pregnant, or if they're immunocompromised. You want to make sure you discuss with the patient and give the consent form in terms of what they possibly could be, have in terms of contraindications. Be prepared to answer questions, disease, pros and cons, legitimate alternatives, typical reactions, serious reactions, where to obtain a vaccine, the cost, insurance, and just make sure you document the conversations you had with the patient. Okay, so here's your adult immunization schedule by age 19 years and older. So on the left here, you have all the vaccines, the names of the particular vaccines, and up here you can see the age range from 19 to 26, how many they should have had. And for instance, your influenza, 18 to 26, you want to get one dose, one immunizations per year. Same thing. So your Tdap, you're going to get one dose when you're before you're 19, and then you're going to get one booster every 10 years. Okay, and then you just follow the graph accordingly. I will tell you there is a website that some people have access to depending on your health department clearance. As a school nurse, I had access to the website that actually tracks the data of all immunizations for each particular person, depending on their age and their social security number. And you can look up, a lot of the pediatricians actually enter into this particular CDC database, like the influenzas, the vaccination records of all of their patients. So when I was working as a school nurse, I had access to that, and I could actually see for people, specifically for patients born in this country and who've received healthcare throughout their lifespan, you could actually see their vaccine records from birth until current, which is actually really helpful. So just keep that in mind. There is a website that you can have access to if you're able to, depending on where you practice. Again, here's this immunization schedule in terms of variation. So up here on the top, you can't really see it in this PowerPoint, but if you go to the website, you can see the variations that they take into consideration and how that works in terms of their vaccination needs. Okay, so obviously there's controversy in terms of immunizations regarding effectiveness, mercury preservatives versus preservative-free, exemptions. You do get people who claim religious exemptions for immunizations for whatever reason that is. There is controversy that immunizations can cause autism and ADD. Not solid proof, but there is definitely research out there. Obviously, there's side effects, as there is with any kind of drug. COVID immunizations are still controversial because they're so new. And then, of course, community distrust in, what are they being injected with? Sometimes people feel like there's a definite conspiracy theory behind immunizations. So it's just important you educate using current resources, specifically resources from the CD are super helpful, CDC, because they are up to par and they are based on evidence-based research. Once the clinician has provided the information to the patient, the decision to take action rests with the patient. So just keep that in mind. Okay, so the influenza vaccine, it comes in injections or nasal spray. There's multiple vaccine options. It's recommended for age 6 months or older, 1 dose a year. There are egg-free options available, so you always want to make sure you're questioning whether somebody is allergic to eggs. You can vaccinate as early as July and August, but it's always recommended by October, which is the start of flu season. You have the quadrivalent inactivated influenza vaccines, and then you have the recumbent influenza vaccine, Fluvac quadrivalent, or you have the Flu Mist, which is a nasal spray, which is live. There's multiple contraindications for this particular Flu Mist. You don't want to give to somebody who's pregnant, immunocompromised, or that somebody who's receiving antivirals, because keep in mind, again, it is a live vaccine. Okay. Again, so we want to avoid any live virus vaccine in somebody who's pregnant, immunocompromised, HIV, it doesn't have a spleen, is in close contact with anybody who is immunocompromised, anybody who has cranial or oropharyngeal communications, cochlear implants, if they've received any of these antiviral meds prior in these amount of days, then you want to hold on these particular live virus vaccine. Anybody with the history of Guillain-Barré syndrome within 6 weeks, also you want to hold off on a live vaccine. Because of the many options recommended, most people get vaccinated in less than 6 months of age, in rare exceptions with severe allergy or Guillain-Barré syndrome. Okay. And then again, additional guidance in terms of the vaccines is right on your CDC website. Okay, so Tdap. It's an injection. So if you did not receive Tdap at or after age 11, you get 1 dose of Tdap, and then Tdap every 10 years, like a booster. Okay, so if you're pregnant, you're going to get 1 dose of Tdap during each pregnancy, preferably early in gestation, 27 to 36 weeks. And in wound management, persons with 3 or more doses of the Texas toxoid-containing vaccine. For clean and minor wounds, you want to administer Tdap or TD if more than 10 years since the last dose of the vaccine. All other wounds, you just want to administer it Tdap or TD if it's been 5 years since the last dose of the tetanus-containing vaccine. And Tdap is preferred in pregnancy. Persons not previously received Tdap or those with Tdap history is unknown. Okay. Use Tdap for pregnant women. Okay. Wound management, we talked about that. Pneumococcal is the pneumonia prevention in adults. Okay, we do the Prevnar 13, pneumococcal 13 conjugate 1 dose, or the Pneumovax 23 variant in 1 to 2 doses. So age 65 or older, you want to give 1 dose of the PSV 23. If it was administered prior to 65, you want to administer 1 dose of the PPSV 23 at least 5 years after the previous dose. Now, if we're 65 years or older and immunocompetent, we're going to get 1 dose of PZV 13 if previously not administered. Okay. The PCV 13 and PPSV 23 should not be administered during the same visit. And they should be administered at least 1 year apart. Again, you want to look at special situations and variations in administering any of these immunizations, especially if they have chronic medical conditions. Okay, so the zoster, the Shingrix, we want to prevent shingles, right? So in 50 years or older, you're getting the 2-dose series of the Shingrix, 2 to 6 months apart, okay? Special situations, you want to consider delaying this RZV until after pregnancy. All right, so remember, shingles prevention starts 50 years or older. That's when you're getting your shingles vaccine. It's important to be conscious of the ages in terms of vaccines because that's how you know it's going to be covered. So 65 or older, we're looking at pneumococcal pneumonia. 50 years or older, we're looking at prevention of shingles. Meningococcal. This vaccination starts in childhood. There's multiple vaccines available, which includes coverage for various subgroups. But keep in mind, this is really important that the student or the person in high school gets this because they will be required to have this in order to enter into college. Because this is a very serious thing, especially with colleges, students in college in residential housing, that dorm, they're at high risk for meningococcal disease. All right, so HPV virus, it's called Gardasil 9. It's recommended for all persons through the age of 26 years. It's 2 to 3 dose series depending on the age at initial vaccination or condition. Usually, they want you to get this by the age of 15, and it's 3-dose series. And then depending on when you start getting it, it depends on how many doses you'll get within a 5-month period. Okay, just remember, look at your ages and see where they fall in terms of their dosage amount and when they're going to need their next one. So we have hepatitis A, which is a 2-dose option, or you could do a 3-dose option. It just depends. It's for patients who want protection and those are at risk. Obviously, anybody with liver disease, HIV, drug use, homelessness, work with Hep A virus or other primates, animals, endemic travel. You want to be very careful and make sure that they have they're up to date on their Hep A vaccinations. Anybody who lives in a group home, daycare facilities for developmentally disabled people, you want to make sure you have Hep A. You want to try to optimally vaccinate 4 to 6 weeks prior to travel to any kind of endemic area. An endemic meaning third world country, not such good sanitary conditions, that kind of thing. Hepatitis B, usually immunized in childhood. You could do a 3-dose option or a 2-dose option. People who are at risk for hepatitis B virus include unvaccinated adults, liver disease, HIV, very similar to Hep A too. Sexual exposure risk, injections, exposure to blood, household contacts with people who are on dialysis, anybody with diabetes, endemic travel, healthcare workers, pregnancy at risk for infection or severe outcome from infection during pregnancy. The only big contraindication in the terms of the Hep B virus is do not use if the patient is allergic to baker's yeast. Okay, don't forget that, that's important. Okay, we have our MMR, measles, mumps, rubella. Most people should have received this in childhood. It's obviously contraindicated during pregnancy, so do not give this if a patient is pregnant. You have to be very careful with anybody who's HIV. You want to check their CD4 count. It's contraindicated for HIV infection with CD4 count less than 200. Okay, so just keep that in mind in terms of contraindications. Okay, varicella. You know, this is for chickenpox. So it's a 2-dose series. I actually got this when I was little. This is actually contraindicated during pregnancy. So it should be given after pregnancy if they need it, if they hadn't gotten chickenpox when they were little. Severe immunocompromising conditions is definitely contraindicated in people with a severe immunocompromised situations. So just be conscious of that. And that's pretty much for all of your vaccines. You want to just be very conscientious with anybody who's got any kind of chronic long-term diseases, pregnancy. You want to just really be conscientious about checking the CDC guidelines. COVID-19, that's our newest and most important vaccine at this point in life. They are obviously IM injections. It's an evolving vaccine. It hasn't been out that long. Moderna has the 2 doses, Pfizer has 2 doses, Johnson & Johnson now also has 2 doses, and boosters are available to enhance protection against strains. So you want to keep up with that data as well, because that is consistently changing as of right now. Okay, so you are an FNP student working with a preceptor in a walk-in retail health clinic. Your first patient is a 20-year-old female who states she will be attending the college out of state next month and has been accepted into a nursing program. She hands you a health form stating she needs a physical one to get all the vaccines she needs. States her mom told her she has had everything since as a child. So you want to find out, you know, what has she had? You might need to get in touch with her pediatrician, see what records she has, which, you know, you're going to want to know which you're going to want to anticipate that you expect which one she's already had, which ones you'd likely recommend, and which you need answered first to make recommendations. So you definitely want to know, she's 21 years old. Is she pregnant? Is she, when was her last menstrual period, right? You want to definitely find out about one of the most important vaccines she's going to need as she enters into her college is the meningococcal vaccine. So that's one you're going to really definitely recommend if she hasn't already had it. And you need to find out what she's already had. You've got to get a hold of those records, whether you get in contact with her pediatrician or hopefully you have access to the CDC website so you can see what is on the website for her currently having. Okay. So here's the answer. So which vaccinations has she likely had in childhood? If up to date, she should have likely had the MMR, HIV, Hep A and B, DTaP, Tdap, polio, varicella, pneumococcal, HPV. But she would need her records to know for sure what she's been vaccinated again. So make sure you keep that in mind. As a NP, one of the things you're going to be doing is collaborating with other healthcare professionals, and you're just going to want to get in contact with her pediatrician or her doctor to find out what her records are. So using the schedules, which vaccinations would she likely need? Is she covered by tetanus, pertussis? She would want to get the HPV if not done. Hep B if not already done in childhood. As she is going into healthcare as a nursing student, she will need Hep B titers before she enters into clinicals, just as all of you do too. She's going to need her annual influenza vaccine for sure. You're not allowed into facilities without both your influenza vaccine and your COVID vaccine. And of course, as a resident on campus, she will be required to get her meningococcal vaccine. So these are the questions you're asking. Did you bring records from your pediatrician? When was your last menstrual period? And are you pregnant? Do you have any allergies? Did you have your routine childhood vaccines? Were you born in the US of A? Because that's going to tell you a lot. You know, countries outside of the USA do not have the same guidelines as us. So you always want to be very conscientious of their immigration status. The date of the last tetanus, are they covered for pertussis? Did you have chickenpox as a child? Did you get the varicella vaccine? See have you had your flu shot? Have you had your COVID vaccines? And she likely was to have B series as a child. And that's it. So thanks guys so much for your patience. It's a lot of information. Please feel free to email me if you have any questions or you just need any guidance in terms of what you're studying. And if you have any questions. Thank you, and I will see you next week.